Hello, everyone. It is 1 p.m. Central, so we will get started. Thank you for tuning in to today's webinar, Creative Ways to Engage Your Students with Realityworks Health Science Resources. My name is Kelsey, and I will be your moderator for today's presentation. First, here is your 30-second introduction to Realityworks for those of you who aren't familiar with us. We are an employee-owned company based in Eau Claire, Wisconsin that creates experiential learning tools for teaching job and life skills. We got our start over 20 years ago when former NASA engineer Rick Germain created the first RealCare baby infant simulator and then went on to found the company that is now Realityworks. Today, our training tools combine curriculum with hands-on learning tools, student activities, and assessments. Baby is still around, but now you can look to us for our tools like our bovine birthing and ultrasound simulator, virtual welding simulator, wearable geriatric sensitivity suits, and if you have some time, we encourage you to check out our website and see it all. Presenting today, we have with us Jamie McIntosh. He is the Education Programs Manager here at Realityworks. Jamie has been with the company for over 10 years and came to Realityworks with an extensive education background as a former educator teaching in Wisconsin and Colorado. His topics cover student engagement, technology in the classroom, filling the skills gap, business education, and various agriculture, welding, and health science topics. Before we get started, I want to cover a couple things. First, today's presentation is being recorded, and all attendees will receive a link containing the recording, as well as a copy of PowerPoint slides and free resources. For those of you attending live today, you will also receive a certificate of completion for attending today's presentation. Keep your eye on your email. You will receive that email within 24 hours after the presentation, and we will have time at the end for Q&A, so feel free to type your questions in the chat or Q&A feature located at the bottom of your screen. With that being said, I'm going to go ahead and pass things over to Jamie.
Hey, thank you very much and welcome. Um, Today we are going to focus on a wide range of different products within health science, but really want to focus on how we engage students. And so we've broken it into two different pathways that I'm kind of going to be talking about today. The first one is embracing geriatric care. Once we get done with this, we will be moving into more of that foundational or fundamental skills training with some of our products as well. But excited to talk to you a little bit today and really talk about some of the products that you see here in the room with me. We have our geriatric nursing simulator. We have our auscultation trainer here with us, but we're going to talk through not only the products, but then how you actually can use them and engage with them. So want to start out with really a focus in senior care. We're going to talk about senior care for this time. And what we're going to be talking about is and really focusing on is three different products. We're going to talk about geriatric simulator. We're going to talk about our geriatric nursing mannequin and then our geriatric sensory impairment kit. We're going to talk about what each one does and then give you some ways to bring about that creativity, bring about that engagement in the classroom, and bring curiosity and usability in that world. So just to kind of start out with, these are some statistics that we found of how it helps your students learn. 83% of participants are able to empathize with life in old age. That's one of those things where our geriatric products, it's not just about what I need to know or what I'm doing. It's also about how do I understand the patient that I'm interacting with. Our geriatric simulator does a great job of that, of putting that student in the position and getting that empathy, that understanding of someone who is in senior care, what they would be dealing with on a regular basis. We also use that with our sensory impairment. Some of the different issues that come as you get older, the ability to empathize, to be able to create that understanding of what someone is going through is very important. And then 95% of participants have better understanding of the physical conditions of aging. And so these products help your students not only complete the task, but understand and have a greater understanding of that geriatric world. So as we kind of go through here, we're going to talk about the power of wearables and mannequin simulation. So oftentimes realism is very important. And so our products bring about that realism, but privacy is also important for your not only your students but for the patient. And so using wearables, using mannequin simulators can help with that. Teaching those skills, that's a big piece that we're going to talk about, those interpersonal skills as well as the technical. What do I actually do? How do I do this? And then creating realism, and also understanding what's going on of that. So in this case here, what we're going to talk about is we're going to go through and just kind of talk each one and then share with you how we bring about different engagements with students. So in this case, the geriatric simulator is one where it comes with a lot of parts and pieces, from the ability to have different impairment glasses, the ability to have gloves that are tight fitting and wrist weights to hold you down a little bit, a cervical collar. You actually put on a chest restraint or weighted vest, and then you have ankle and elbow restraints as well. All of this makes you have an understanding of some of the different issues that you would see with an elderly patient in this case. So from the visual impairment, there's different diseases and issues with the eyes. And then with all the different other pieces here, it talks about it helps that student to have to realize what's going on, and what's different than maybe what I am and that student is at a much younger age. So working in things like joint stiffness, loss of strength, fatigue, those types of things are all important in this product. Now, what does this look like? Well, some of the things that we've had students share are things about how what they've taken from it, and then also teachers. One of them has said that when used properly, empathy suits, in this case, our geriatric simulator, give important insight into patient's experience for the wearer and allows patients to share their experience and frustrations with the learners in the caregiver role. This is a very important piece of information and a talking point for your students, both in pre-brief if you're doing a simulation and post-brief of doing a simulation. Why is this helpful and so important? It allows you to interact with your students and get that understanding of experiences. And we're going to talk about some of those experiences and engagement opportunities that you can do with your students. So that experience and the functionality of it. The other side of this is it allows students who are not in the same age realm to get that understanding for what it is like for their patients that they're going into and working with. So some of the highlights of our geriatric simulation here is we go through visual impairments, declining mobility, aging on joints and bones, hearing loss, all right, cognitive changes with aging, and then we have them interact with the whole experience as well. So giving them that understanding so then they can be empathetic and interactive with their patients on a much better level. The next one is our geriatric sensory impairment kit. This is a fun one because it allows students to be able to go kind of that next step into it. It includes arthritis simulation, it includes hearing impairment simulation, and then geriatric tremors. And so as students get to this impairment, they actually have to do different activities. And that's where the engagement really comes in, of having to do different activities where they have hearing impairment, where they have to write or do activities, and they have our geriatric arthritis simulator, which then has to be used and worked on. Now, again, in this case, some of those highlights are that hearing and impairment loss, the age of bones and joints, and then the tremors of the elderly. The last one then is, and I have it right here, and we're going to use him a little bit today, is our geriatric nursing mannequin. In this case, there's 15 basic nursing functions that we go, and it starts right up here in oral care, being able to do oral care and also nasal care, and suctioning and working in that world. Trach care, we also have mouth cavity and artificial teeth care. So working with someone who might have some of that oral needs in that sense. We go to the catheterization. So there's ability to do catheterization, patient transfer, moving him around, or her, because it is both male and female genitalia and also chest regions. And so in this case, moving them around. How do I interact with them? Bringing these two together from our geriatric nursing mannequin and our geriatric simulator, so that as you bring them together, they understand, what does it feel like? And now, how do I interact with someone in the in senior care? So basic care, catheterization, bathing and range of motion, intramuscular injections, and then also pressure injuries are part of the curriculum there. So talking about those three products, I want to now create some engagement through simulation experience and give you some examples of ways to do this. So the first one is kind of bringing role playing or gamification into your classroom. Now, in this case, role playing and competition is really allowing students to be assigned different roles in the classroom. So, lead nurse, a family member, a patient, allow them to be able to work together. And in this case, on our Jerry mannequin. And so one could be talking as the patient, one could be a family member, and then one could be that nurse and working together. What would the family member be saying in this situation? What would be the patient be talking about? I have just done and used our blood pressure simulation. So I have our blood pressure here, but going through the role playing of, okay, putting the cuff on, talking to them while I'm doing it, having to listen for the sounds, pumping it up, being interactive with them. So using it a one-on-one, so that role play, what are the scenarios that I'm going to do? Having somebody else come in and talk for the patient or be the patient, because with our blood pressure, you can take this cuff off and you can put it on a human being. So interacting with them as well. So it gives points or little opportunities for you to interact with your patient here. But that role playing, how would I talk about this? How would I interact in these different scenarios here is really important. One thing that we also include, we have a medication mannequin quick scenario set. This is a great feature that could be added to your classroom. And what it does is it gives different types of scenarios from infant to pediatric, adult, and then also geriatric, different simulations and different types of scenarios that you can walk through that, again, as a teacher, you wouldn't have to interact with or create yourself, already created for you in that way. One of the things that we have is we have our basic patient care, and it's a bathing checkoff. And so this is one of those types of activities where you could go through this and do a role playing activity where you have to interact with the mannequin here and go through a bathing routine in this sense. Okay, how are you going to do that? Are you washing your hands? Are you taking care of? Are you asking the patient different questions as you're going through it? So creating a scenario that fits this bathing scene and then walking through, having your students do a pre-brief. What are the things that they're worried about? What are the things that they think are going to happen? What do they have to remember? Then going through the scenario. And then after the scenario, if you as the teacher are watching them, it's always important to debrief, to walk through what went well, what are some issues that they had, what were some problems that maybe came about. Did you think about how they were feeling? All those different things to interact with in that engagement through role playing. Another one that's fun is the ability to develop really rich and patient backstories. Not only doing them, and we talk about scenarios a lot in the scenario-based learning, but don't always have it where you're actually doing the one doing the backstory. Might be a great place to have your students create their own patient health histories here. Now, in this case, all right, if you're doing it on another a mannequin, if you're doing it in the real world, it's a great place to have them create those detailed stories. Now, some of the things that they can go through is, the emotional dynamics that are going to be involved, any health issues that they're going to have. What are some of the emotional responses that could come back to you? What is the social interaction going to look like? Have them create this backstory for them. And another way to do this is, interact with your students and have them think of different situations that they've been in before. It might be their own world. It might be families. It might be something they've seen on TV. What are the trends that are happening? But have them write out different backstories, different scenarios where they're able to then work through that. Now, one of the great pieces about this with a engagement is that, one, they're creating these backstories, they're creating these scenarios of what the patient history are that then are going to be played out in a role playing or in a real scenario situation. The other side of this is it also allows them to have to think through what might be some of those interactions that we would see in the real world, making it much more realistic, making it much more kind of relevant to them. And then if they would ever do a live human interaction there, maybe it goes better, maybe it goes worse, but it gives them that kind of understanding of what all that is and how all of that works together in a patient kind of dialogue and patient simulation. What we have here, this is a great one for that, is have your students go through our arthritis experience chart. This is one with our actual geriatric sensitivity, I'm sorry, sensory impairment kit, excuse me, going through that where they actually have to put on the arthritis devices. They have to put those on their hands. They have to go through and cut paper with scissors. They have to write with a pen. They have to open a bottle. They have to drink from a cup or a glass. All right. Now, those are things that we've created so then they have to go through that simulation experience with the backstories. What is something that your students maybe would want them to do, depending on the situation? The person's from a rural area. Maybe they are a farmer. Maybe they are have to do different types of things on a farm. And so, what kind of different tasks would have to picking up a bucket versus picking up a clothes basket, based on what the different backstory is and the patient history is, maybe using some of these to engage a different way and have them start looking at how do I interact? What would that feel like for me? Is a very kind of fun and interesting way to work through some of these types of opportunities. The next one is incorporating patient perspectives. All right, making you really kind of look at this and see what's going on in this world for your students. The piece here is really what we've known and we see is that we do not learn from experience, we learn from reflecting on that experience. So we want our students to be able to be very reflective, very interactive with what's going on. So a great way to do this is have your students do some sort of research or interview with either patients if you have them, maybe each other, or with family members, and have them go through a situation where they actually have to, ask different and address different things. If I was going to do a bath for you, what were some of your fears? What are some of the cultural beliefs maybe you have? What are some of the communication things that we're going to have to deal with? How would you, interact with that person? Walking through some of those different situations. All right, I'm going to do a blood draw. What would that feel? How would that make you feel? What would you want that person to interact with you? Have some of those research opportunities or interview opportunities with each other so they're getting themselves into the place and engaging together, but engaging with their teacher, their patients, and then you as a teacher seeing how they're actually kind of taking on those different parts and pieces. One of the things we have here for you is we have a geriatric checklist here. Okay. So in this case here, this is where our geriatric simulator, when you put on the whole simulator, you also open up and do different activities like opening a pill bottle, like writing your name, walking up and down stairs. So in this case here, walking down the stairs, buttoning a shirt, different things of that nature. Here's a checklist that you could engage with your students to then say, okay, how would you do these things? Now bring it back one step in and bring it to your perception is, okay, if somebody is doing these things, how would it make them feel? Is there frustration? Is there feeling of uncomfortableness? Is there feelings of exasperation? What is it that they are feeling and doing? So going out and trying some of these things with that geriatric simulator, having the students put themselves in the place of a elderly person, and then coming back and saying, okay, this is how I felt. Now go talk to somebody and say, how did you feel? What was it that you took away from this? Those are the types of things that could be very beneficial to bring your students from going from, hey, this is what I felt, how would you feel? And being able to interact and record those observations. Some key considerations for you to always kind of be remembering is making sure that everything that we just talked about here in different experiential learning opportunities is Are you aligning with your learning objectives? What is it that you really want them to understand? Is it the training piece of it, which we'll talk a little bit more in a second here? Is it that empathy part? What is it that you're aligning to? Provide clear instruction and expectations. This is what I want you to get out of this. Facilitate effective debriefing. Probably the biggest thing that we've seen and that in simulation experience is that debriefing part. Again, it's that, hey, go do the activity, but reflecting on it and saying, how did I do? What did I learn from it? What things went well? What things did? If you miss out on that, that's a key kind of consideration that you're missing out for that student learning to be able to understand. And then gather feedback and adapt. And we're going to talk about some more opportunities here, but see, how do they feel about it? Did they like that activity? Would you do it again? Now, I want to jump into um, a few more sections here that focus on things like basic skill training. So we're going to move away from our geriatric focus here, which again has its own specific needs because of the elderly population there. What are they feeling? What are they seeing? Can be very different than a lot of other patients that your students would be seeing who are coming in for and getting checked with vital signs, things of that nature. So we're going to focus on 4 different products here and kind of interactions with this world. So when we talk about these, one of the things that we're kind of focusing on is just basic or foundational nursing skills. So in this case, we're talking about our blood pressure simulator, our auscultation simulator, and our multi-purpose training arm. We're also going to throw in our ECG, which can be something that a lot of times is that next step in learning about and helping within the training of nursing simulation. But really want to focus on these different individual products, what they do, and then how can you use them to engage your students. So starting with our blood pressure, all right? Our blood pressure, and I have it here with us today. It is here or on here. It can fit on a mannequin, or it can fit on a human as well. So in this case, I have it on the mannequin, and it really is a great teaching tool because it teaches, am I putting the cuff on properly? Did I put it in the right place? Am I putting the stethoscope placement correctly? There's various practices that you can do from this. We have a electronic box that allows you to hear an unlimited number of different um, readings, so you can actually walk through this and check it over and over again. So there's a multitude of different blood pressure readings that and scenarios that you can go through here, but it allows you to do the other interactions too. So if you're doing it in a wearable situation and you have it on a human, then you can be talking to that person. You can interact with that person. If you're doing it on a mannequin, it allows you for that practice, going over and over, making sure they have the different readings correctly, that the Karakov sounds are where they need when you're listening. Did I hear it? What am I supposed to be doing with the pulse? Allowing you to be able to go through all of the different features of the product, but really learning and being able to do that protocol time in and time out. So in this case here, as we look at this, it focuses on making sure that you can read the dial, making sure that you know the equipment, and then working with the different categories and working with the different, elevated blood pressure, high blood pressure, hypertension, and then normal, and then going through those and being able, can I hear the reading every single time? Can I read it? And then it gives you the answer of what it was so that you can continue to practice and gain that confidence in this world. So, for blood pressure, some of the programs, it's really is that nursing med assistant. It really hits a wide variety of health science careers because it's something where you do that in a vital signs. And so it is a very widely used thing and a piece of the puzzle that almost all nursing students should know. Our next one, and I don't have it here, but it is our multi-purpose training arm. All right. This is one that is a great product that allows the instructor and the student to be able to do different types of injections. So IV insertion, intravenous bolus, you got your phlebotomy, and then also intramuscular injection. So a lot of different things on this one arm. The really neat thing about this is with our fast fluid system, you can have flashback during procedures. It allows that water slash fake blood to be able to go in and really helps you to see what's happening, but also know that you're doing it correct. And then with our self-healing skin, it allows you to do this over and over again, allowing you to be able to see and interact with it over and over again. So some of the programs here, again, nursing, medical assistant, patient care technician, it's that practicing on injection, blood withdrawal, phlebotomy prep, all those things that really are involved with that understanding of, okay, this is that step that I need to take if I want to continue to grow in my nursing career. And then our auscultation trainer, which I do have here behind me as well, so you can see the size of it. All right. It does have a skin overlay, so then you can't see all the parts and pieces on the inside, but the skin overlay allows you to then have that person's skin there, and then going through and being able to hear the different heart, lung, and bowel sounds, being able to do that. There's 40 different scenarios with 21 different sounds that walk through all the different things that are kind of going on or that you would hear, allowing you to be able to use our reality scope where you use your own stethoscope. You hook it right into your reality scope and then listen to all those sounds on either stethoscope. It also has a jack where you can plug in your audio jack and listen to it in a classroom setting as you would need as well. So programs for this one, again, nursing that medical, because it's that correct placement for listening and also hearing the different issues and on the heart and lung sounds as well. And the last one that we're going to talk about is our ECG, EKG trainer. Okay. This one is one where, do I know how to place a 3, 4, 5, or a 12 lead? Where would I put those? How would I best implement that? And then being able to see the different EKG rhythms. So in this case here, one of the cool things about this is as it comes with a tablet, you can put on the different leads, 3, 4, 5, or 10 or 12, excuse me, and then it will give you different rhythms, and you can look at each one. You can work through that, memorizing, understanding what is the rhythm, what's it actually showing me. So it tests and records that electrical activity of the heart. And so that pumping action, it gives all those things for you. Now, walking through those, what I really wanted to get to and want us to look at is how do we, again, create engagement through this simulation experience using these types of products, and how do we create engagement? So I want to start with kind of an overview here in the simulation environment. So in this case here, when we talk about the simulation environment, we're really looking at if you have the sim lab, you might have a single room just like I'm in where you have a table for them to work on. It may look very much like an actual clinical room, or it may look very much like a classroom. But one of the things that we can work towards is how do you help kind of get that transformation of, hey, this is a different situation, this is a different scenario that we're going to put. So your environment's important. So one of the things you can do is have the students become the teachers. This is a great little opportunity to then have your students create their own lab, make them come up with what it should look like, how it should design, what they remember. All right. Now, it could be something where you recreate different scenes and maybe you want to do different one. It could be emergency room, could be an operation room, could be home health care. It could also be out in the field if you're a paramedic or you're in the world of EMT. So it could be any of those areas. The other thing that you can do is, have them talk through and create kind of a TV show location. Have your students help you to transition where you would be putting on a show that would be like a classroom. So kind of a fun activity for them to incorporate. The other piece is, really helping them get that realism are things like props or moulage kits, being able to bring and see not just, hey, there's a pressure sore here, but actually having a pressure sore there, having the ability to use realism in the simulation environment. So having those props around you, having the ability to have them wearing the gown, having them need to put on the gown, having them interact within that way. So some creative uses of simulation environments. Now, want to go through again some different pieces that can help in engagement here. First one kind of works in that gamification, but really that competition. So scenario-based challenges. This is a great one for your students to think about. Think about different challenges that you can do with your either individual students, a teams, or a whole class. In this case, some of those and health science is really great for some of that kind of competition. So can you understand and get the correct diagnosis? Can you do timely interventions? All right. When we were talking about our multi-purpose training arm, all right, can you do the blood withdrawal? Do it correctly, do it in a timely manner. Having some of that interaction and being able to have the students have a little bit of pressure, a little bit of need to engagement, all right, effective communication, doing those types of things. Another great one is, are they using correct medical terminology while they're doing it? You might have a point system here where you could have points in this challenge where, hey, if they're using the right terminology, they get extra points. Having some sort of scenario-based challenges is really fun and engaging for your students. Now, in this case here, one of the things we have with our blood pressure checkoff is just that you could turn this into some sort of a scenario-based challenge. All right, have your students all have to go through this. Have them be able to make sure they put the blood pressure cuff on correctly. Did they, start with and put the dial where they can see it? Are they able to then pump up the cuff? Are they able to read it? How close are they to the actual number? Have some of that engagement, that competition. Where does that student, multiple students, that team, where do they end up with? What is the best? We have somewhere with that engagement, do it on a Friday, do it on before a holiday. Do these types of activities where you're doing it to engage the students, but really they're getting better at the skills that they are accomplishing. The next one is kind of a fun one, and I've heard about this from multiple different instructors. Is doing different types of things like an escape room style simulation. All right, so design your simulation or your sim lab in a way where they have to do certain activities and they have to do it in correct order before they can go and almost escape from that scenario. So having them make sure that their procedures are correct, they're doing it in the correct order. Anything that you can do to make sure that they're doing it in a procedural way, doing correct order, make it into some sort of escape type scenario where, hey, if you go in the wrong order, you're still stuck there until you do it the correct way. All right. This encouraged some critical thinking and is kind of a fun, interactive way. One of the ways that I would look at this and something I would do is with our phlebotomy arms. Now we have our geriatric simulator, and we have a place where they would use phlebotomy in this. And so, starting from a very, beginner point where, okay, did they wash their hands? All right. Did they then put on their gloves correctly? Did they sterilize put a tourniquet on? Do they sterilize the location? All right, going through all those steps, and especially for those newbies, you add pressure here where you're watching them. You're going through that. Have them do 5 to 8 different steps to complete that task. Put them in an order. If they didn't do it in the correct order, go back, start them back where they ended up, or maybe have them go all the way to the very first step and have to start over. Now, what does that do? It gives them repetitive opportunity to do that same kind of training over and over again. It brings some fun, interactive opportunities to where, hey, they can laugh at themselves, they can interact with others, they can maybe get even a little bit of a frustration, or kind of that situation where, hey, can I do this even when it's challenging or it's hard, and coming out on the other side, so that having some uncomfortability is not a bad thing. Another one that's kind of in that same one is choose your own adventure simulator. And a great place for this is with our auscultation trainer and our ECG simulator. In this case, use kind of similar to escape room situation or simulation, but in this case, allow students to be able to choose their own adventure. Have them talk to each other. What are some things that they want to learn about? Where do they want to go with these training opportunities? So if they have family members who have certain type of breathing problems or heart problems, they may want to go down a road of, I want to learn about this. If they have other opportunities where, I've heard of this, but I've never seen it before, I've never done it, they may go down different activities in that sense. So lead this, kind of open to the adventure that they want to pick. Let students help with their own learning. It also helps to bring about kind of what's the outcome in this situation for the students and for the overall adventure. What am I learning from doing this? Now, sometimes it's going to go and it could be, oh, I didn't know that. Sometimes that's exactly what I thought, but it allows them to choose those different narratives in that world. So we have an example here with our ECG simulator. In this case, you have the opportunity to have them go and do four different adventures: a 3-lead, a 4-lead, a 5, or a 12-lead. Give them those and allow them to pick which one they want to do. All right. If it's very early on, they may choose a 12 lead and not realize, oh, that's much more difficult. There's a lot more nuance to it. There's a lot more things to work on. It may be a harder situation. That will stick with them when they continue to learn these things. So it could give different readings. Have them learn through those experiences as they kind of work through that adventure on their own or with classmates. The last one here that I want to talk about is what I call scenario immersion. This is one where, are there other ways that you can help your students to learn and engage? In this case, one of the things that we continue to hear about, and a trend that continues to be there, is telehealth simulations. Being able to talk just like we are doing here, where you're not in that same room with them. They're asking you, you're asking them questions, they're giving you responses. Could you set something up like that up? Now, one of our products that we also have is our healthcare interpersonal skills program. So this is a great add-on piece where it will talk through and work through how do you interact with somebody. And then I would always suggest to walk through the simulation with your students. Have them on the other side of a Teams or a Google Meet or a Zoom call for realism. Have them on the other side and actually have their computer and have to walk through some of those things. Some of the great pieces, we have a kit that is all about medical terminology. And so are they using the correct terminology? Are they using interpersonal skills? Are they interacting with, and then again, I can't see what the problem is. I can hear it through being descriptive. I can hear what the issues might be. Well, what does that relate to? Talking through some of that and understanding that interpersonal interaction can be a great thing, but not just doing it in a classroom, actually having them on the computer, having them walk through and practice those effective communication skills is another great opportunity for bringing engagement into your classroom. The last things that I want to talk about in our time here is really focusing on, really two ends, the bookends. It's not only the debrief, but it's also the pre-brief, walking through what are they getting themselves into, having them have those patient histories, having those opportunities to understand what the simulation is going to be. That's really important. The other side of that is your debrief and reflection. Here are just 4 ways that you can help your students. The first one is, what if scenarios. Once they get done with the debrief, have them sit down and have some what if scenarios for them. All right. As they've gone through, what if this went wrong? What if this happened next? What if this didn't happen how you thought it was going to happen? Ask students to consider different protocols, potential issues, and then outcomes that could come from both if you saw them doing something inaccurately or if you saw them doing it all right. Okay, what's that next step? Walking through that debrief and asking those questions is so important to the learning process. Another one is a self-reflection journal. Have your students have a journal where every time they do a simulation, you're going to have to give them time. So take out 10 minutes of your class period, but allow them to reflect on the performance they did, what they could improve upon, what the scenario was talking about, what they learned from it, what they want to do better next time. have that ability for self-reflection because it sinks in then for those students. The next one is what we call reverse simulation. Have students take the role of the instructor and design a scenario. Now, this is usually very helpful for the instructors. It's something that it can be taken off your plate, but it can really help students to own the simulation, own their learning, but it also allows them to design a situation that they think is maybe difficult. They don't fully know how to do it, or they want to see it done. And so they've created in that way, allowing them to kind of get feedback of what is it that they want to do? What is it maybe that they're having trouble with? Help them by helping themselves by designing a scenario, and then require them to have objectives, learning objectives, have the concepts that they're going to learn from that scenario, make them work through that, and use that as a piece of the puzzle from both the reflection side. Why did you choose this one? But what did you learn from the process of the whole simulation here, and knowing what's happening and having to interact with that and seeing it from all sides. The last one, then, what I call is concept mapping. And this is just visually connecting the actions taken. So in this case, it's that situation when you're talking to your patient, and let's say we're going to do a blood pressure with my geriatric patient here. All right. Instead of me walking through and doing all this stuff, I would start with a concept map first. I would write it out and say, okay, what am I going to do? Well, I'm going to introduce myself. Hello, who am I? Who are you? Interact with them. That would be part of the beginning of the concept map. The next thing, well, where do you go from there? Well, then I would probably start talking about, okay, well, this is what we're going to be doing. So I'm going to need your arm. I need you to roll up your sleeve. Start walking through what you're going to be interacting and talking with them through. Then I'm going to start the procedure. I'm going to start doing what I'm there to do. All right. Then, I'm done with it. This is what the readings tell us. This is what you have. Moving from there, having them walk through and write out the different concepts is not only good for them to visually, but also kind of mentally walk through what is going to be happening. It also is a great place to then interject in and see, okay, did you miss anything? Are there things that should have been put in place that aren't in place? Those are the types of things that allow them to all of a sudden get those aha moments. Oh, yeah. Okay. I said, my name, I didn't ask them for what their name was. All right. I didn't interact with them when I was doing the procedure. How would they have felt about that? Allowing that to be able to help can be really helpful in a debriefing and a reflection type activity. So with this time we've come through a lot of different things. We went from the geriatric senior care and empathy world to the hands-on nursing SIL training world, kind of looking at two different areas, but hopefully gave you a lot of different ways to engage and interact and bring forth some different opportunities to go forward with your students. So with that being said, we'd love to connect with you. We'd love to help you with any type of questions you have. So we do have local Realityworks account managers for you to get a quote on anything, to ask more questions, to get better understanding about what your program needs or how we could help with your program. So there is the opportunity there. If you scan this, it will then share with you what that information is for you. This is a time now for questions. So if you have any questions, please feel free to ask those questions now.
Perfect. So we did have a couple questions roll in, Jamie.
Okay.
First question is, can you give any examples of questions you can ask students to evaluate the increase in empathy?
That's a great question there. And this goes back to that kind of the pre-brief and the post-brief, or the pre-brief and the debrief. And one of the things there I would say is always in the pre-brief is to ask certain questions just about that. Okay. It may be as simple as, do you have grandparents that are still alive? Do you see them often? Do you know people who are senior citizens? What do you know about them? It might be some of those questions to get them thinking about, what do I know about someone in senior care or in elderly care, and what are some of the things? It could be questions like, what are the stereotypes that you know about that? What are those things that you could interact with them to be able to say, okay, here's what I think of when I think of senior citizens. It could be something of what type of diseases or ailments or things do the elderly normally or of come into to be cared for about. What are those types of things? That gets them starting to think about that empathy in the sense of, what do I know? What's my pre-knowledge of it? Maybe what are my biases? And then when you go in and you do certain simulations, when you do our geriatric simulator and they have to go through it, that's a great place afterwards then in that debrief to say, okay, what frustrated you? What was the surprised you? What issues do you have? What was easy for you? What does it feel like to be someone who has certain ailments? Those are all great questions. And then afterwards, to a lot of times you can do a point system. What do you think you know about elder care? What do you think how patient are you with people? You can ask some of those questions in the front, and then afterwards do another survey or questionnaire and say, okay, now you've done this. Are you still in the same boat? Do you think that you still have the same empathy? Are you higher on that scale because you went through some of these things? Those are just some general things that could be helpful there.
Perfect. And then another question here. How much does the geriatric mannequin weigh?
Geriatric mannequin weigh, let's see, it's around 50 pounds. So I can pick him up here, but it's around 50 pounds for the mannequin itself.
Perfect. And I think that is all the questions that we have at this time then.
Okay. I should say, the great thing about the Jerry mannequin, not only, with the weight, but also, one of the cool things is that the range of motion to be able to move, and I have him hooked up here, but, the range of motion to be able to move him and interact with them, again, to be able to place them in this sense, a seat into a bed, all that movement and things like that is very helpful and very, I would say accurate or realistic. So then you are working within that world, not just the weight, but how it actually moves, how you have to interact with that mannequin. All right. With no other questions, thank you for your time. Thank you for joining us. If you have more, again, please connect with us. Love to talk with you. Love to help you get what you need for your educational purposes. Thank you for your time.